Vishal, it's a pleasure to have you on the Mind the Gap podcast. And as you know, I like to get straight into the conversation. And I know that you have a background in the world of consulting and the world of strategy when it comes to businesses. And one question that I've had on my mind for the longest time is, do you think when we're building health tech companies that we're actually building from a place of passion, as in like we care about health and um we're doctors and we're academics and we really want to deal with the health side of things. And in that, we actually forget about the business side of things. And the reason I ask this is because I feel like a lot of health tech companies take so long to generate revenue. So do you think we're not getting the business side right and we're getting the passion side right? Or is there something that people are completely missing in that dynamic?
So I do think you need both. I agree with you that you see a lot of passion projects out there in the health tech space, and you wonder what what is the point? How is this going to end commercially successful? But as you've also highlighted, developing health innovations takes a very long time. So if you don't have that passion, you won't keep going and persevere. So I do think you need the passion to keep going on that long, hard road to get to the end destination. Whether fundamentally your idea has got commercial um, potential or not, it is going to take a long time to realize that potential. So you need to have the passion to sustain you. So that is a prerequisite. But then I absolutely agree, because people are so passionate about some of their ideas in healthcare, they are, and they don't necessarily, they've not had the exposure to kind of commercial settings or commercial environments in the past, that they do lose sight of whether there is revenue to be generated from this product or not. A part of that is because the health system takes such a long time to adopt technologies, and before you may have something that actually really impressive, works really well, and that there does seem to be a business model that is built around it. Nobody wants to take it up, just very risk averse. So that thing is fine. But then there are other times where I think you can't articulate your business model. You can't say, someone will say to you, in an ideal world, there are 10 customers queuing up for your product actually, and they're willing to pay. What does that business model look like? What are they paying for? What's their return on investment, etc. If you can't articulate, then I think you do have a problem. So I think you have to be able to articulate the ROI. Um, then you have to sort of be patient and wait for the customers to come. And that requires you to have a lot of passion to maintain that perseverance, I would say.
And where do you think that these health tech companies or just companies in healthcare generally can then make their money? Because from the outside looking in, I think everyone always has the assumption that we're just going to build this thing and we're going to get an NHS contract and great, like everything's smooth sailing from there. Is there other avenues that people could potentially get revenue from if we're just building a very generic healthcare company?
There are plenty of avenues. I do think that the NHS remains a really valuable and sensible avenue to consider as part of your strategy. Now, if that is your whole strategy, it works for a select few types of businesses for sure. Select few types of use cases, you can pin everything on the fact that you need to succeed in the NHS. But for the vast majority of use cases and businesses and products, you will need to have a plan to diversify your revenue streams. Firstly, because the NHS revenue stream will take a lot longer to come on stream, but also it may not be sizable enough for your use case to sustain you, and it will just grow the company to the size where it can meet all the regulatory hurdles required, et cetera, et cetera. And so, there are alternatives. Increasingly, people are willing to part with their disposable income to stay well, physically and mentally. And they are much more willing to self-pay for services which they know the NHS will not cover. So when you start bleeding into that well-being space, it's clear that the NHS simply does not have the to cover it. And it isn't a kind of immediate enough newsworthy topic like treating breast cancer or preventing lung cancer. Sorry, I shouldn't say preventing or treating lung cancer. And, the NHS is not going to go down, pour loads and loads of money into some of these preventative measures. And so I think if you're in that space, you have the potential to generate some revenue from self-pay. I think that understanding how pharma works and trying to develop a product that is meaningful and valuable to pharma is a value. To be honest, I think mostly in the drug development space or possibly the clinical trial space. I think there are other areas at the moment in pharma which are so valuable that pharma know exactly why they should be purchasing a service or acquiring a business in the health tech space if it's not to sort of target those two areas. There is that. I would then say you need to look abroad, to be honest. So, then you need to go beyond the UK. At that point, I'm not going to say things like private healthcare providers in the UK. I'm not going to say our private insurance companies, because they're relatively small. They cover 7 to 8% of the UK population in terms of private health insurance. There's a limited amount of revenue that you can gain from those avenues.
Yeah, I think it's one of the things that I find, like if I'm looking at healthcare and the business of healthcare, generally speaking, I think, have you ever heard of like J curve businesses?
Jacob, I'm trying to picture them now.
So even for context to the
Oh, it's like the
listeners,
hockey,
a J
Oh yeah,
curve,
sorry, so you were talking about the hockey stick, right? So
yeah,
wow,
kind of. So like when you're starting off your business,
so
a lot of healthcare businesses are J curves. So this initial phase of it going down is the phase where you're losing money, basically. Like these are all your startup costs, hiring staff, building the tech, and then eventually you want to get to the point where it's going back up. And this is your expanding into the USA, your NHS contracts, and everything in between. Um, but I've just always thought like the only place in healthcare where you can kind of get a business and have something that's almost revenue generating from day one is more so like you're saying in the preventable space, like the wellness, um, those kind of spaces. But then that means that the individual who's using the service has to pay for it. And one of the things that when we created one of our apps before, someone said to me in a customer feedback session, they were like, this is great and I really love this service, but why should I have to pay for this myself just because the NHS doesn't provide it? Like I'm almost being penalized. That's why I have to pay for it. Do you think the UK people in the UK, just lay people, have the appetite to be paying, I don't know, a subscription for a wellness app? Or is that customer segment like really specific in the type of person we're targeting?
I think it's growing. If you'd asked me 10 years ago, I would have said it's challenging. Actually, there is just a much greater interest in being healthy and living a healthy life now than there was previously. If you look at the younger generations, it's things like they don't drink as much. I mean, smoking rates have gone down. People are, I think, starting to get more interested in cooking their own food in terms of understanding what they are eating, counting the calories. Not saying that's necessarily a good thing, but people are really getting into the finer details of what they're eating, and actually, I think that there is an increasing interest in mental well-being as well. So doing so-called effectively exercises for your mental well-being is becoming a really big thing now because, unfortunately, the prevalent rate of anxiety, depression, early stages of those conditions is really going up a lot. And so I think there's a lot of factors around now which are pointing to the idea that you can make a success of a preventative health business. Um, I think that where you can find B2B revenue streams within that, it's helpful. So, going to employers and going to, um, other, I guess this is where it gets challenging, because you're still back to that sort of private insurance space thing where there isn't much private
Mm,
insurance and therefore there isn't that much appetite amongst the private sector to fund healthcare services, but it is changing slowly. So if you look at companies like Google, um, they are exploring more and more what can they offer their employees beyond what a standard private health insurance scheme offers, beyond the treatment within those four walls, because they recognize that if they can do more on the preventative side, their employees will value that, because they will say, well, you care holistically about my wellness and not just about making sure I'm fixed when I'm broken. So, I definitely think also amongst that B2B space, amongst the employer space, there is some increasing interest. So the challenge you face is that the barriers to entry in that space are much, much lower. There's much less regulatory um, requirements. There is, no need to be a medical device necessarily, et cetera, et cetera. And so that with that comes lots and lots of competition. Um, so, I think that then becomes your big challenge, and differentiating yourself as well in that space is quite difficult. Much easier to differentiate yourself in a very specific clinical offering for a particular condition or a sub condition. But much harder on the preventative side, because actually everyone's got similar types of ideas, to be honest.
I've always looked at preventable healthcare businesses as, for me, that is like, if I had to build the perfect business just based on principles, I think it would have to be preventative healthcare, because it really frustrates me when I'm in hospital and I see people with things like hypertension or diabetes or other conditions, which ultimately, if we dig down to the core, are extremely preventable. But I think the unfortunate part when we're talking about preventable stuff, is that there is a lot of misinformation that exists in that space as well. And I know in your role at YouTube, one of the biggest challenges that you face is almost regulating misinformation when it comes to healthcare. I wanted to find out, what is YouTube doing to almost address that challenge of misinformation in the healthcare sector?
Yeah. So, yeah, as you say, it is a massive challenge. The approach that we take is what we call the 4 Rs framework. And so we would look to remove any blatant misinformation from people. And so we have a range of different medical misinformation policies. And we overhauled our medical misinformation policies recently to be much more broad, comprehensive, to cover prevention, treatment, denial of basically any condition out there. So there is now, a lot of content that can potentially qualify as misinformation. And therefore, we can then detect content and transparently and objectively remove it, because we can say that it clearly states in our medical misinformation guidelines that, XYZ is prohibited on our platform. And that is how we would then try to tackle a lot of our misinformation. We'll try to remove those videos before they get even a single view. Are then working really hard to raise up high quality authoritative information. There isn't any point removing the bad stuff unless there is good high quality stuff to replace it. You end up with a vacuum where no one's saying anything. And at that point, YouTube loses its value and influence in the space. And so we're working really hard with individual clinicians, with NHS organizations, with health charities to create content, make that content as engaging for the viewer as possible, and help them to target the biggest content gaps that we have on the platform. And then we've launched our health features recently, which basically mean if you search for any health topic, at the top of the search results, you'll see a shelf labeled from health sources, contains videos specifically coming from authoritative sources. If you then double click into any one of those videos, you will see a label attached to the video giving you a context about the credibility and the source of the video. So it may say something like, from a licensed doctor, from a licensed nurse, from an organization with a licensed health professional. And so that then gives the viewer a sense that this is coming from an expert source, if that is what they want to consume. So that's the kind of the raise up piece. And then obviously we're always looking at lower quality, lower credibility content that's on the platform that is maybe not blatant misinformation, but it is lower quality content. It's not coming from an expert source. It doesn't cite any evidence base. That type of content we then work hard to push down, suppress in the algorithm, so that it can be kind of it can be superseded by that high quality health information.
So, what is there anything stopping? Let's say I am a doctor, I get signed up to the health features. So, under every single one of my videos, it says from a licensed doctor. is there anything that is stopping me from one day then turning around once I've built up an audience of, let's say, 500K followers, and then just spewing misinformation because I've now got the people watching? Um, what measures are in place to almost tackle that? And do you think that's going to happen, or do you think people are going to appreciate their own personal brand of being a doctor more than kind of being a content creator?
Yeah, I mean, I suppose I would have to be quite naive to believe that could never happen. I think the truth is that good eggs can go bad, and things can go in different directions, and people chase what they think the audience wants, etc., etc. But for us, the approach that we take, and this applies not only to health content but all content on the platform. Every single video that is uploaded to YouTube is reviewed, it's analyzed, it's run through a combination of our algorithms, and also a kind of medical, for the health content, medical doctors in the loop who will then check for any misinformation. So then it goes back to what I was saying before. How do we remove misinformation? Because what we're comfortable with is that every single video gets a check. And if there is misinformation in that video, it will be flagged and it will be removed. So as soon as a video is flagged from one of these channels that's currently in the health features, that then changes the equation for them. It means that they are no longer necessarily eligible for the health features, but we will have to figure out on a case by case basis what that means. Now, sometimes there's a misunderstanding which has led to the misinformation, the perceived misinformation. Sometimes there was kind of one video which went in a different direction, but actually once removed, the rest of the content is staying on the straight and narrow, or actually it is part of a kind of a targeted plan to veer more into the misinformation space. And then, in those situations, we would absolutely take action, remove the relevant, the kind of the violating content, and also consider whether those channels should still be part of the health features. That is a every second by second dynamic review process that is taking place. We are also then regularly checking the medical licenses of all the individuals that are part of the health features. So as soon as their medical license lapses, then the periodic checks will pick up, and at that point they will no longer be eligible for the health shelves. We want to make sure there's actively practicing doctors on there who are maintaining their license. And hopefully, if you're maintaining your license, it means something, and it also has implications for the type of content that you're putting out on your platform.
Yeah, because I think the thing that instantly comes to mind is during the COVID pandemic, and you had doctors who were saying get the vaccine, and you had doctors who were saying don't get the vaccine. And I just always wonder, like, what is our baseline for what constitutes to good information versus misinformation? Because science as we know it is very dynamic and ever changing, and it's something that we constitute as misinformation today that potentially could be correct information in like 5 years from now. Um, is there a baseline for what your criteria for misinformation is?
Yeah, and you're right. It's so challenging, isn't it? It's so dynamic, and we have to be so careful, therefore, about not kind of casting aspersions on certain content, which is maybe topics that, points of view that we don't agree with are maybe not scientifically incorrect necessarily. So what I would say here is that we lean very much on our partners. So that is why we work so closely with the WHO, for example, and they help us to understand what are the latest clinical guidelines there. We work really closely with the Academy of Medical Royal Colleges, the Doctors Association. We work really closely with the NHS, and various other locally relevant organizations that are, have a much closer handle on clinical guidelines, clinical evidence than we as YouTube do. And so for us, those partnerships are really important. They help us stay abreast, and help us to sort of get a grounding in what is kind of current considered scientific opinion. Um, but it's challenging, and I think there's probably more work that we can do here to be more transparent about saying, exactly which clinical guidelines are XYZ videos on our platform adhering to. And some of our creators are doing that. They will actually cite some of the guidelines from NICE, for example, in the description of their videos. And one of the principles within the Academy of Medical Royal College's information sharing principles document that they put together is that you are citing an evidence base for the kind of the points of view that you are putting forward. And so The question then, of course, can be, well, what constitutes an evidence base, and what good evidence and what isn't? And so I think that that is a kind of an evolving question and picture. But we're trying to do what we can to stay on top of this by partnering with health experts and health organizations in each of the different countries where we operate.
Yeah, and it takes almost that entire ecosystem of people to be able to actually deliver the message which we want to deliver. And I just wanted to move on. Like, of course, this is a podcast where we talk about improving healthcare for minority communities. One thing that I think loads of people assume is that big corporates and big organizations always have trust just by association. And from all of the work that I've done, one thing that I've learned is just because you have a massive blue NHS logo on something doesn't necessarily mean that people from marginalized communities are going to trust you. What ways is YouTube doing anything to almost bridge that trust between marginalized communities and almost valuable information online so that we kind of don't create a world where YouTube again is something that people don't trust when it comes to getting healthcare information?
Yeah, so I think the real value and power of YouTube is that it really is world's online platform. It really is easily accessible to everyone creating content on the platform, and everyone's consuming content. And what that means is you get a real diversity and richness of perspectives. So you get content, think about it in the health context, you get content which highlights the cultural nuances and relevance of certain conditions to different ethnic groups. You get content in a variety of different languages which can target different groups. You get content delivered by such broad range of different clinicians. And so, you will have seen it when you've been to some of the YouTube health events. You'll see it if you go onto the health shelves. There is a real breadth of kind of background that the health experts that we are profiling within the health features have got. And then we're also taking, so there's an inherent value that we have as YouTube in terms of being able to access such a diverse range of population. But also we're then being really intentional at this because we know how important it is. And so, uh, you know, we have great influence and reach, but therefore we know we can do even more and more. And if we layer more initiatives onto the platform, we can have even greater on underrepresented groups. And so we have recently launched the IQ, which is basically a health equality accelerator. The idea is that we're trying to support channels are creating health content targeted at underrepresented communities and targeting specific conditions for those underrepresented communities, things like sexual health, things like mental health, things like maternal health, which are disproportionately affecting certain underrepresented communities. And so we have recently launched that program in the UK. Any channel that is creating content targeting those underrepresented groups is eligible to apply to be part of the IQ program, which then gives them a pot of funding to create content. It gives them access to regular best practices, data insights around creating content for those groups. And sort of will help to facilitate collaborations for them with other organizations that are also operating in a similar space. And so you can get more information on the YouTube Health website if you go to health.youtube. Applications are open until the middle of October, I believe. And so that is an intentional step that we are taking to try to get more content onto the platform that is targeting underrepresented communities, because we appreciate that we could still be doing more than we currently are.
I think that is like, I love when I hear solutions like that because they get straight to the problem. I think, like, for instance, one of the things I can imagine that's going to happen on YouTube just by how the rest of the internet works is almost like when the health content creators kind of get a lot bigger on YouTube, is you will still have to go on YouTube and type in, for instance, eczema and then add black skin at the end of it. It's because you already assume that all of the videos that you're going to see is never going to be inclusive of whoever you are. So by having initiatives like that, it's almost like, I would like to assume at the moment, of course, we don't have the results on what's going to happen afterwards. I would like to assume that naturally, by having initiatives like that, you just naturally get a more diverse perspective when you're searching in the content creators. Because I know if I'm watching YouTube, for instance, I usually watch people who I feel a little bit relatable to. And I imagine for health YouTube, it's going to be even worse. Like people want to see someone speaking the same language as them, potentially with the same accent as them, potentially in the same country as them. With this in mind, is there any, like YouTube's an international organization, is there any challenges that you think people will face when it comes to targeting content for different regions of the world? So, say a British doctor and someone that the person watching the videos in India, for instance, or South Africa or Brazil. Is there any challenges that are there, or is it scope for a greater reach?
Yeah, I mean, I think that there are certain niche areas where clinical guidelines are significantly different between countries. But even then, it's probably mostly around pathways as opposed to the symptoms of a condition, how one would diagnose a condition, how one would prevent a condition. I think those things are fairly universal truths, and therefore, I think there's actually a massive opportunity there is where I would net out on that one. Because now the health features that I have described are available in every single country around the world. And therefore, if you are a UK based doctor creating content in English, there will be viewers in Nigeria, viewers in South Africa, viewers in Australia and Canada who will be able to, in due course, access your content when they're searching in English in on their respective YouTube browsers, and therefore, that you can get the best of what exists around the world. There is then also a local relevancy to our results, and therefore you're more likely to see UK based content when searching in the UK than you are elsewhere. So we recognize that people maybe want to hear from people who are geographically similar to them, but I think it's much more a language that people are conveying that information in. And therefore there is a great opportunity here to try to really disseminate that quality information to so many different countries.
Cool. Now, if we move on to the doctors as content creators, I've always been super interested in the business of content creation, like how you have Mr. Beasts of the world, the Sidemen, and everybody else who make money, which 10 years ago was not even imaginable. If we're thinking about health content creators from a business perspective, obviously on YouTube, people generate money through AdSense and ads and everything else. Is there routes to monetization when you have a YouTube health channel, or is this something which is almost a conflict of interest?
I think it's a personal choice. It is for every single channel to independently decide the approach they want to take to this. So, for example, NHS organizations are typically not monetizing their channel. Part of the objective for them to be on YouTube. Individual clinicians who are on YouTube, clinician creators, a lot of them are monetizing their content because for them, it is requiring an investment of their time to create the content. So, I know that this whole world of creators and the creator economy is new, but the old version of that was people paying to produce TV programs and then distributing them. It was the biggest difference was that the distribution platform were a lot more closed and a lot more difficult to break down and get into. Because really it was just a few key broadcasters, a few key channels, and a few cable companies who were buying the rights to all the different programming that was out there. And therefore, there wasn't that diversity of programming, even though a lot may be being created, not that much was being bought and therefore distributed. But those individuals and those teams that were creating that content would still need to be reimbursed for the time they put creating that content. And so it is the same with the individuals who are putting the time to create content on YouTube. And so we have developed a mechanism, a seamless mechanism by which they can be rewarded for the content that they create. But we have also put the power fully in their hands to decide if they want to monetize, and if they do, which types of adverts they want on their channel as well. So I think that yes, absolutely, it is an opportunity for some of the clinician creators out there. Equally, for a lot of them, they're driven predominantly by the impact they can have, by the opportunity to share health information at scale, which they cannot do in their clinic settings one to one. And I think that excites them a lot. But also for a lot of them, it's a creative outlet. It breaks up the day job and gives them something very different, exercises very different muscles in the brain. And I think that that is a real motivator for them as well, more so than kind of the financial reimbursement.
Yeah, because I've always thought like when I look at US doctors and their YouTube channels, let's take a Dr. Mike, for instance. As much as they are creating their channel to deliver value and sometimes just entertainment, generally speaking, because of the healthcare system there, it in a backdoor way kind of does increase the numbers of people coming into their clinics. However, in the UK, we have a free healthcare service. So if you have Dr. Malone, for instance, in London, if I'm creating content, it doesn't necessarily bring more people into the clinic because I work in an NHS hospital. Is there other routes outside of like YouTube monetization that you think health content creators can explore? Maybe ones which are not even there yet, but are just things that you've seen from people early on. Yeah.
Yeah, so I think that one of the great values of building your profile and sharing your ideas on YouTube is that um, you are basically making yourself known to a lot of different people, and they can then identify you as an expert in a particular area. And that then leads to a range of different opportunities. So we have quite a few of our YouTube creators who have published books. For example, Dr. Julie's got a book out, Dr. Nigat has got a book out. Dr. Curran is coming out with a book later this year. So, massive opportunity in that space. There's also opportunity in terms of developing courses. For example, Geeky Medics, which Lewis grew up on YouTube, but then expanded out into to sort of offering the courses that he now does via his own website. There are a lot of our creators who are getting into podcasts now as well as an additional revenue stream, which of course you can do on YouTube, but you can also then publish this podcast off YouTube. There are a lot of speaking opportunities that are coming the way of our YouTube creators because they are clearly seen as experts, world experts. So they're going around the world to share some of their expertise on certain topics. They're contributing to articles in the news. They're providing advice to charities, to kind of healthcare startups, et cetera, et cetera. So there's lots of different opportunities that can open themselves up. And so effectively, it is like starting any other business. You start your YouTube channel, that becomes your business, and then you become quite entrepreneurial and you explore the different opportunities that then opens the door to.
And I think YouTube is a massive opportunity, especially when it comes to connecting with those people who are in underserved communities. Because a lot of the time, I used to say when I would go to NHS meetings with all these CEOs, and people would look at me like I'm crazy to say that a platform like Instagram and TikTok and even YouTube are more authoritative sometimes for health information than the NHS website. And people would genuinely think I'm like absolutely psycho. And I was like, it's because people don't trust the NHS website. But when they go on TikTok or YouTube, they see Dr. Malone and they trust Dr. Malone, not necessarily the NHS website. And I think there is a lot of potential in this space. And I'm very excited to see where health creation goes because, in my opinion, it's a relatively new space. And I would be interested to see, especially in the UK, given all of the stuff that is currently happening in the NHS with the workforce, will this become a route for people almost out of medical school whilst they're doing their training? Does this almost open up another lane aside from the training pathway? And then lastly, one thing which is a tradition on this podcast is I always ask people how they would improve healthcare for their communities. Now, you can define your community in any way that you want. And we want to know who your community is and how you'd improve healthcare for that community.
So I think what I'm most immediately doing right now is developing a clinician creator community, which you are very much part of, and lots of the other players in that space. And I think that this is a burgeoning network of individuals want to create impact scale using the power of video as a medium. And so I have spent a lot of my last 2 years nurturing community, bringing them together, giving them the skills to empower them, encourage them to create content online. And I'm very excited to see what impact it will have, as you said, in terms of addressing inequalities, addressing some of the challenges that the health system is facing, not just in the UK, but globally. So that for me is kind of the main thing I'm doing right now in terms of community building to help improve the healthcare system.
Okay, amazing. Well, thank you so much for being a guest, Vishal. I think the IQ health equity accelerator is something that I personally will definitely be looking into, and everybody else who's listening to this, I would also assume if they're an audience of this podcast, they will also be looking into it as well. And thank you so much for being a guest on our podcast today.
Thank you for everything you do in the health inequality space. Thanks for having me.